Welcome to NSG 412 Study Session 7 Major Health Challenges or Problems of Children in Contemporary Days. Introduction. In this study session, we will focus our discussion on the major health challenges of children. We will also consider examining those health-wise problems that children may be faced with in the contemporary days. Learning outcomes. When you have studied this study, you should be able to 1. Discuss extensively the health challenges of children. 2. Explain the problems of children in the contemporary days in terms of contributory factors and health implication. Major health challenges of children. Children under the age of 5 years die from preventable and treatable illnesses such as diarrhea, acute respiratory diseases, measles, and malaria. Illness is usually complicated by malnutrition. UNICEF and WHO Health Organization developed the Integrated Management of Childhood Illness in 1992 with the aim of preventing and early detection and treatment of these childhood killers. Childhood malaria. Children under 5 years of age are one of the most vulnerable groups affected by malaria. There were an estimated 584,000 malaria deaths around the world in 2013, of which approximately 78% were in children under 5 years of age. Young children are particularly vulnerable because of their low immunity. Childhood diarrhea. Diarrhea disease is the second leading cause of death in children under 5 years old and is responsible for killing around 760,000 children every year. Diarrhea can last several days and result to loss of water and salt that are necessary for survival from the body. Most people who die from diarrhea actually die from severe dehydration, electrolyte imbalance, and fluid loss. Children who are malnourished or have impaired immunity, as well as people living with HIV, are most at risk of life-threatening diarrhea. Types of diarrhea. There are 3 clinical types of diarrhea. 1. Acute watery diarrhea. Lasts 7 hours or days and includes cholera. 2. Acute bloodletting diarrhea, also called dysentery. And 3. Persistent diarrhea. Lasts 14 days or longer. Causative organisms. The common causative organism of diarrhea is the rotavirus. Thus, it cannot be cured with antibiotics. Occasionally, bacteria cause diarrhea, e.g., Campylobacter, Salmonella, Shigella, and E. coli. Some bacterial diarrhea can be treated with antibiotics. How diarrhea spreads. Diarrhea is a disease of poverty and poor personal and environmental sanitation. Diarrhea germs are easily spread from person to person, especially from child to child. Infection is spread through contaminated food or drinking water, from person to person as a result of poor hygiene. Signs and symptoms of diarrhea. 1. Passing of stools that are less formed and more watery than usual. 2. Fever. 3. Loss of appetite. 4. Nausea and vomiting. 5. Stomach pains. 6. Blood or mucus in the stool. Signs of dehydration. Moderate dehydration. 1. Thirst. 2. Restless or irritable behavior. 3. Decreased skin elasticity. 4. Dry skin, mouth and tongue. 5. Sucking eyes. 6. No tears. 7. Decreased urination. Severe dehydration. 1. Symptoms become more severe. 2. Lack of urinary output. 3. Shock. 4. Diminished consciousness. 5. Rapid and feeble pulse. 6. Low or undetectable blood pressure. 7. Pale skin. Prevention of childhood diarrhea. Interventions to prevent diarrhea include: 1. Safe drinking water. 2. Use of improved sanitation and hand washing with soap. 3. Use hand sanitizer when washing is not possible. 4. Exclusive breastfeeding for the first 6 months of life. 5. Good personal and food hygiene. 6. Health education about how infections spread. 7. Rotavirus vaccination. Management of childhood diarrhea. 1. Rehydration with oral rehydration salt (ORS) solution. ORS is a mixture of clean water, salt and sugar. Diarrhea can be treated with a solution of 1 liter of cooled clean boiled water, 5 cubes or 10 tea-level spoon of sugar, and 1 tea-level spoon of salt with zinc tablets. The mixture contains NaCl 2.6 gram or 1, trisodium citrate dehydrate 2.9 gram or 1, glucose hydrous 13.5 gram or 1, and KCl 1.5 gram or 1. It is cost effective. ORS is absorbed in the small intestine and helps in the replacement of the water and electrolyte lost in the feces. Zinc supplements. Zinc supplements reduce the duration of a diarrhea episode by 25% and are associated with a 30% reduction in stool volume. Nutrient-rich foods. The vicious cycle of malnutrition and diarrhea can be broken by continuing to give nutrient-rich foods, including breast milk, during an episode, and by giving a nutritious diet, including exclusive breastfeeding for the first 6 months of life to children when they are well. Acute respiratory infections (ARIs). Acute respiratory tract infection is another cause of mortality and morbidity in children. It is a form of infection that can interfere with normal breathing. ARIs are infectious. They can spread from one person to another. They can be classified as upper respiratory tract infections, URIs, lower respiratory tract infections, LRIs. Causes of acute respiratory infections. Infection is usually caused by viruses or bacteria, and this can manifest in any area of the respiratory tract such as nose, middle ear, throat, voice box, air passage, and lungs. Viruses that are responsible for ARIs include 1. Adenovirus, causes cold, bronchitis, and pneumonia. 2. Pneumococcus, meningitis, and also triggers pneumonia. Rhinoviruses, common cold. Modes of transmission. Viral respiratory tract infections spread when children's hands come into contact with nasal secretions from an infected person. Infection can also spread when children breathe air containing droplets that were coughed or sneezed out by an infected person. Mild burning of the eyes, feeling of pressure in the ears or sinuses due to obstruction, and or mucosal swelling. Other serious symptoms are high fever and chills, difficulty in breathing, stridor when calm, low blood oxygen level, loss of consciousness. Cough is associated with 30% of colds and tends to start about the 4th or 5th day when nasal symptoms decrease. There may be a mild increase in body temperature. Infants and young children are more likely to develop higher temperatures. In infants, there may be irritability, snuffles, resulting in difficulty in feeding. Diagnosis may be difficult, and fever can be the main symptom during the early part of the illness. Management of acute respiratory tract infection. The main emphasis of management is symptoms relief of fever, nasal congestion, and coughing. Common constituents of such medication include first-generation antihistamines, analgesics, antipyretics, paracetamol, or anti-inflammatory agents, ibuprofen, cough suppressants such as dextromethorphan, expectorants, and decongestants. Adequate rest and fluid intake. Use of antibiotic in childhood URTIs remains contentious since more than 90% of the infections are of viral etiology. Prevention of ARIs. Routine vaccination to prevent influenza. This can be taken by children from 6 months and above. Good hygiene, regular washing of hands by children and caregivers. Problems of children in the contemporary days. The health of today's infants and children is threatened by many factors that did not exist 50 years ago. Some problems are related to parental behavior, while some are related to socio-economic condition. These problems include HIV/AIDS, gun violence, child abuse, drug trafficking in schools and neighborhood. Problems related to parental behavior are smoking, abuse of alcohol and other drugs, family violence. Problems related to socio-economic factors are poverty and homelessness. HIV/AIDS and children. More than 240,000 children were infected with HIV During 2013, around 700 new infections every day. In addition, millions of children every year are indirectly affected by the impact of the HIV epidemic on their families and communities. Symptoms of HIV in children: failure to thrive, failure to reach developmental milestone during expected time frame, enlargement of lymph nodes in several areas of the body, brain or nervous system problems, seizures, difficulty in walking, frequent childhood illnesses, opportunistic infections, oral thrush. It is vital that children who were infected via mother-to-child transmission receive treatment to keep them healthy and live to adulthood. If they are not on antiretroviral treatment (ART), a third of children who are living with HIV will not reach their first birthday, and half will not reach their second birthday. Child abuse. Child abuse is the willful infliction of physical injury or mental anguish on a child. It is a major child health problem in both developed and developing countries. Each year, approximately 160,000 children are severely abused. Over 3 million are abused or neglected, and 1,000 to 2,000 die as a result of assault by their caretaker, generally a parent. Children are vulnerable by virtue of their size, age, basic dependency on adults, and lack of power. They are at greater risk of being injured in their own home by a family member or other care provider. Family of any race, class, income bracket, religious background, and neighborhood can be violent or neglect their children. Hence, the need for community health nurses to assess any child who comes to the clinic for any form of abuse. Child abuse can be grouped into physical, emotional, sexual abuse, or combination of the three. Physical abuse. It is not accidental physical injury, ranging from minor bruises to severe fractures or death as a result of punching, beating, kicking, biting, shaking, throwing, stabbing, choking, eating with a hand stick, strap, or other objects, burning or otherwise harming a child that is inflicted by a parent, caregiver, or other person who is responsible for the child. Physical discipline, such as spanking or paddling, is not considered abuse as long as it is reasonable and causes no bodily injury to the child. Signs of physical abuse. Consider the possibility of physical abuse when the child has unexplained burns, bites, bruises, broken bones, or black eyes. When the child has fading bruises or other marks noticeable after an absence from school. 3. Seems frightened of the parent and protects or cries when it is time to go home. 4. Shrinks at the approach of adults. And lastly, reports injury by a parent or another adult caregiver. Sexual abuse. Sexual abuse includes sexual activities by a parent or caregiver, such as fondling a child's genitals, penetration, incest, rape, sodomy, indecent exposure, and exploitation through prostitution or the production of pornographic materials. 6. Decreased anal tone. 7. Genital pain or itching. 8. Acropresis, enuresis at inappropriate developmental stage. 9. Genital trauma and or bleeding. 10. Excessive masturbation. 11. Sexual acting out with younger children. 12. Age inappropriate sexualized behavior or language. Emotional abuse. Emotional abuse or psychological abuse is a pattern of behavior that impairs a child's emotional development or sense of self-worth. This may include constant criticism, threats, or rejection, as well as withholding love, support, or guidance. Emotional abuse is often difficult to prove, and therefore, child protective services may not be able to intervene without evidence of harm or mental injury to the child. Emotional abuse is almost always present when other types of maltreatment are identified. Indicators of emotional abuse. Indicators of emotional abuse include withdrawal, depression, suicide, anxiety or fear, self-destructive behaviors, substance abuse, sudden changes in behavior, sudden school difficulties, dramatic mood extremes, sleep disorders, nightmares, repeated runaway, aggression. Child neglect. Neglect is the failure of a parent, guardian, or other caregiver to provide for a child's basic needs. Neglect may be physical, failure to provide necessary food or shelter, or lack of appropriate supervision. 2. Medical, failure to provide necessary medical or mental health treatment. 3. Educational, failure to educate a child or attend to special educational needs. 4. Emotional, inattention to a child's emotional needs, failure to provide psychological care, or permitting the child to use alcohol or other drugs. Signs of child neglect are: 1. The child is frequently absent from school. 2. Begs or steals food or money. 3. Lacks needed medical or dental care, immunizations or spectacles. 4. Is consistently dirty and has severe body odor. 5. Lacks sufficient clothing for the weather. 6. Abuses alcohol or other drugs. 7. States that there is no one at home to provide care. It is important to recognize high-risk situations and the signs and symptoms of maltreatment. Health workers, especially nurses, should possess skills which can enable them to identify any form of abuse in children. Any case of child abuse should be reported. Other problems in children are cigarette smoking, gun violence, poverty, health implications. Environmental exposure to tobacco smoke (ETS) is associated with increased rate of respiratory disease, reduced lung growth in children, increased rate of lung cancer, and exacerbation of cancer in children. Screening of children whose parents smoke should focus special attention on respiratory complications. Health education of parents must emphasize the direct and indirect effects of smoking on children. Referral should also be made to smoking cessation programs to help to protect the health of the child. Gun violence. This is becoming rampant in this contemporary world, now as school children are now being abducted by violent men with guns. Consider the abduction of 276 female students from government secondary school in the town of Chibok in Borno State, Nigeria, on the night of 14th to 15th April 2014 by the Boko Haram, an extremist and terrorist organization based in the northeastern Nigeria. Poverty. Poverty is defined as either relative or absolute. Both are important determinants of health. Absolute poverty is also called abject poverty, and it means adequate needs such as food, shelter, and health care cannot be provided. Relative poverty refers to inequitable distribution of wealth within the society. More than 40% of people living in developing countries live on less than $2 per day. Children and poverty. Children are more likely to live in poverty than adults. 1 in 5 children live in poverty in developing countries, and poor children are likely to die before their first birthday. They may go hungry, become malnourished, develop slowly, and have more health problems. They are also likely to drop out of school and engage in criminal acts and have children while in their teens. This perpetuates the cycle of poverty. Children living in poverty have higher incidence of asthma, as poverty contributes to the etiology, exacerbation, recognition, and management of asthma. Children living in poorer communities are at increased risk for a wide range of physical health problems. 1. Low birth weight. 2. Poor nutrition, which is manifested in the following ways: inadequate food, which can lead to food insecurity or hunger, lack of access to healthy foods and areas for play or sports, which can lead to childhood overweight or obesity. 3. Chronic conditions such as asthma, anemia, and pneumonia. Contributing factors to problems in children are poverty, inequality or relative poverty, lack of access to care, maternal education, conflict, war or disaster, individual characteristics, teen parenting, substance abuse, intimate partner violence, and divorce. Health implications of problems in children. The major health implications of all these problems in children is reflected in the child's mortality and morbidity rates in the countries. The higher the rate of all these childhood problems, the higher the rate of infant mortality and morbidity. Study session summary. In this study session, we focused our discussion on the major health challenges of children. We also considered the health-wise problems that children are faced with in the contemporary days. End of study session 7.